And this is Dr. Aida Nguyen. I'm a geriatrician with the Department of Geriatric Medicine at JABSA. Thank you for joining us for the Long-Term Services and Supports COVID Preparation Series. A special thanks to our collaborators, the Hawaii Emergency Management Agency, Healthcare Association of Hawaii, Hawaii Association of Directors of Nursing, Hawaii Medical Directors Association, and Mountain Pacific Quality Health. We usually have a brief presentation and then we open it up for time of questions and discussions up to 3 p.m. And we asked you to use the chat box to submit and queue up your questions. John, if you could forward the slide, forward that, and we can just put up, this is the schedule of upcoming sessions. So you can see things you can look forward to, including this Wednesday. We're going to be talking about COVID challenges and opportunities in assisted living, looking at some experience on the mainland. Okay, and then just to remember that next Monday is Memorial Day and we will be taking a short break, but we will be back on the 27th. We are also now offering CMEs. So in order to register, in order to receive CMEs, you need to register and complete the evaluation. And so just follow those instructions. And I see everybody is getting used to this and they're all putting in their names in the chat box. They read my mind. That's what we do for attendance purposes. And for those calling on the phone, we would like you to tell us who you are. If you could either type it in or unmute yourself and tell us, that would be fantastic. I'm just going to give you just a second to do that. Let's see, I'm looking on the chat box. Okay, great. And under the participation list, we actually don't have a lot of folks on the telephone. John, is there a bell that keeps ringing every single time people come on and off? Does that?
Let me turn that off.
Yeah, it's a little distracting. Okay, great. Okay, so now I'd like to introduce today's topic is helping dementia residents through COVID challenges. And our speakers are Tanya Hammond-Tullis. She has a master's in counseling and school counseling. She has a BS. She's a BS in social work and 20 years of experience in long-term care, and she comes to us from the Alzheimer's Association. We also have Dorothy Colby, who is the Director of Community Engagement for Hale Kawike, and she has over 20 years of experience in dementia care, and she is also Positive Approach to Care Certified Educator, and she's working with Hale Kawike. And we have Dr. Brett Liu, who will be joining us from the department, from the John A. Burns School of Medicine, Department of Psychiatry, who will speak to us briefly about Geri Psych. So at this time, I'd like to just open up to Tanya, who will start us off. Thank you.
All right. So, gosh, this has definitely been a hard time, I'm sure, for folks that are living in the nursing homes and assisted livings, and I know that you guys working with them are experiencing a lot of unique challenges. So we're going to kind of touch some of those. John, if you want to click to the next slide. So just a little bit of numbers for you. So 48% of nursing homes have folks with dementia. And I know that we have a lot of memory care homes and things like that around the island. So we are considering those too. So 42% of residents are in assisted living care facilities. So 42% of, that should be folks that have dementia or Alzheimer's. So that's a lot of people that are living with this disease, with dementia and Alzheimer's. And we know, definitely, that that the residents are at more of a risk, and I'm sure that's just adding a lot of pressure to you and the families, and maybe the ones that can remember a little bit. It's gonna be a little bit more stressful than usual. So according to some estimates, and this number is from the Alzheimer's Association, there's more than 27,000 residents and workers that have died from the coronavirus. So this is this to me tells me that our kapuna and the workers, this is something that's very serious, and we're more of a case where it's 25% of folks, 27,000. There's about 91,000 today of people that have died in the U.S. So that's over 25% of people that have died. So it's very in the nursing homes. It's just in the assisted living. It's something that is definitely need to keep them safe and to keep our workers safe. So let's go ahead into the next slide. So there are some challenges, and there are just definitely some that we know with COVID-19 they're going to come about. So some that I think of are, have your residents, have they had a hard time with social distancing and washing their hands? I'm sure they have. I'm sure that they've or probably don't want to wear a mask. If you had them take it off and wonder why they have to wear it. What about changes in routines and disruptions? And sometimes I would think with the different equipment that folks that are wearing protective equipment I would think that it would frighten or it would confuse some of the residents. And just thinking about the fact that family or visitors or volunteers haven't come in on a regular basis. And so there's a lot of different aspects to it. And what about falls? Have there been increased number of falls with the residents? What about weight loss? So if you go to the next slide, I'll show you, I did call and chat with some folks around the island, a director of nursing, a couple of director of nursing, and then some administrators, and just kind of I had some questions, and I just wanted to kind of get a feel of what was going on. So, about when you think about folks that have dementia and you think about them eating and being reminded and being cued, and sometimes families will come in and every day and eat lunch with them and help them eat. And now that families aren't coming in, has that hindered the people with dementia? So those are just some questions that I was thinking about, and I had a great answer from one director of nursing. Some residents have actually gained weight because they're more sedentary, which is not a good thing to gain weight, but yet I like to hear that because they are eating, and the food must be really good. So that made me happy. And then another said all staff have been assisting with feeding at this time. And I would think that would mean maybe some help from the office staff and other folks. So nobody had any weight loss or falls in the folks that I've talked to. And then how is your facility approaching hygiene? So they had one where the in-services were given to the staff, but also given to the folks at the nursing home that lived there. So that was something that was interesting. And then residents are supervised on a hand washing schedule. So that's something too that's going to be added, I'm sure, to a lot of the list that things have to change. So, and then I got someone say we disinfect every day, railings, bathroom, the doorknobs, all light switches, all chairs, all tables, just everything. So they're just doing that much more than the average. And then I had one say we've marked the floor with duct tape to ensure that people are social distancing. So that might add to some confusion too, as far as what is this X doing here? So there's all these things that kind of go along with it, and how activities has changed. So that for me is something. I know that folks love bingo, and I didn't put this on here, but it was because it was too much to write. But I had one tell me that each resident would be in their room, and they would have walkie-talkies, and then they would call out the number, and then that's how they would play bingo, through the walkie-talkie, which I thought was pretty creative. And then some, maybe they have two or three folks that are in activities, but they are 6 feet apart. And then another said all activities are done one-on-one in each individual's room. And I would just think that's a whole lot of work for the activities, and maybe the activity staff, and a social worker. That's just a whole lot of work trying to figure out schedules and those type things. And back to the schedules, there are some of the things that folks have said that they have schedules where they will phone call the families on a regular basis. So it varied from place to place, and I guess it just depends on the staff that can do it and what is available. But it sounded like everyone was kind of getting in touch with the families on a regular basis, and those type things. So it was good to hear. So next slide. So when you think about how do we respond to this crisis, Alzheimer's Association recommends that person-centered care is the best fit for folks with dementia. And person-centered care, I'm sure you guys know what it is, but this is just kind of a reminder. It's a care that's tailored fit to each resident's special cognitive and social abilities, and it enhances their strengths, and it really focuses on their memories, and it will enable them to function at a higher level. And then, so if you guys aren't already doing this, it's just recommended that a nurse or someone that's a licensed clinician complete a HIPAA personal information form on the folks that you're working with, and maybe just kind of attach that behind the closet door, or maybe behind somewhere that can't see from just if you're just walking by. So if you want to go to the next slide, we'll tell you a little bit about what you can put on that list. And so you want to put their names and their cultural background. Now, I'm from the South, if you can't tell, and so I might not understand the same culture as someone that's from here. So I think that's really important to know what someone's cultural background is, because we do things a little bit weirder in the South. And what about religious and spiritual practices? I think that's so important for our kapuna. And then hobbies. What are hobbies and interests? Names of family and friends, and what upsets this person? What kind of can upset a person, and what maybe will calm them down? Sleep habits, drinking habits. What is their typical behavior? Remaining abilities, verbal processing. Are they slow to process things? Does it take them a while to understand and come back? Usually with dementia that it does. So those are some things that are just important, just to kind of have a snapshot of people that you're caring for. And if you want to go to the next slide, John. So people with Alzheimer's and dementia do just we know that they depend on schedule and structure and routine. That's a huge thing. And with this, it has been a disruption in their schedule, right? And us too. So everyone's been extra stressed. So, keep in mind that dementia-related behaviors, which I'm sure you probably have already seen, can occur in these changes. So, John, if you want to go to the next slide. So, you want to think about strategies. If you are seeing someone with dementia displaying these behaviors, first you want to rule out any pain. Is there any pain that's going on? Maybe that's something that you can't see. Are they hungry? Are they thirsty? Do they need to go to the bathroom? And when you do speak with them, make sure that you speak in a low pitched tone, like this. A lot of times, older people can't hear the high pitched sound just because it's harder for them to hear. So low pitch is better. and it's also more calming. So try to reduce excess stimulation. So if there's anything else going on, any chatter, any music, any, loud sounds, just want to make sure that that might not be the issue. There's a lot of different distractions that can go on that would maybe upset someone with dementia, and they're not able to tell you. And what's important, I think, for us too, as just humans, just to validate their emotions, focus on the feelings. What are they feeling? They can't tell you usually what it is that they're going through, but maybe they can tell you through, even if you just look at them, tell you how they feel. And a lot of times a hug would help, or just just saying, I'm sorry, it's going to be okay. Maybe not offering them a solution, because maybe they just want to be validated. So John, you want to go to the next one? Okay, so strategies continued. So understand that the person may be expressing thoughts and feelings from their own reality. So if their reality is, say they're 80 now, but say their reality is when they're 30 years old, and maybe they were in the war and they feel something is off, maybe they might be thinking in that error. So you want to offer them reassurance and understanding, and just validation. And through you want to try to meet the person's need with an individual plan of care. So I know you guys probably do have care plans on everyone, but maybe just if you have more of if there's behavior issues, what kind of care plan would be sufficient for that. And also be aware of past traumas. So, and you want to never physically force someone to do something. All right, so next slide. So Alzheimer's Association, we are here 24/7. We have a helpline, and that number is 808-272-3900. And that anybody can call that number. We have a lot of our caregivers or our folks with dementia or Alzheimer's call. And any questions that you want, we will help you with. And at the next slide, we'll show you the next slide. And so we are definitely have shifted. Everything is virtual or by the phone. So we continue to have our support groups and our education programs. And if you are interested in an education program, there's the training.alz.org. We have several education programs that would really be good for this time. We have one that's called Understanding and Responding to Dementia-Related Behaviors. It's a really good one for this time. And we also have one that's good. It's effective communication strategies. And it kind of just goes over different strategies, how you would communicate with someone with dementia in all of the different stages. So we do have a lot of different education programs for you and for families and caregivers. So just let families or you guys just know that we're here to help. And thank you so much.
Great, thank you. And I just wanted to ask, just to make sure, there are Alzheimer's Association offices on the neighbor islands as well, right?
Yes, there is. All of the islands, Maui, Hawaii, and we have folks there too that would be willing to help.
Great. All right, Dorothy, you're up next.
Hello. Hi, everyone. I'm Dorothy with Hale Ku'ike. And thanks so much, Tonya, for sharing all that information from the Alzheimer's Association. I wanted, in my part, to connect with some of the things Tonya had said, but to focus specifically on the experience that we are having here at Hale Ku'ike. We are exclusively memory care. All of our residents are living with some kind of dementia, whether it's from Alzheimer's disease or others, and the full range of levels of dementia from early to towards the end of life. And I know that made all of us as professionals working in different aspects of healthcare and long-term care have had experiences with having trouble communicating with someone who's living with dementia, whether they don't understand what you're saying or you don't understand what they're saying. So this challenge around communication is not something that is specific to COVID-19. But so one thing I want to say is right now we're on Zoom and we're using, a lot of you are listening on the phone or listening through work, and we have this slide up on the screen, but we're relying very heavily on verbal communication. With this one slide that I have up, this is a dementia cue card of kind of a screen share of one that you're going to be getting afterwards from Positive Approach to Care that you'll be able to take back. But verbal and this kind of a high language communication is very hard for people who are living with dementia. The language centers of their brains have changed and they are not understanding as much of what we're saying as we think they are. So one thing I wanted to see is on Zoom, there is a way, if you want to give this a try, you might be seeing me in a little corner on the side, but there is a way to in the upper right, you can switch to make a full screen so you can see me fully, or see who's speaking fully, or see just one person as opposed to all the people. But I'm gonna be using I'm gonna put my hands forward into the camera here. I am gonna be using my hands and giving some visual cues to you, because that is gonna be my major topic today, is people who are living with dementia get much more information in. Here's the information coming in from the world, from what they see than anything that they hear. What you look like makes, and what you're showing them with your hands is a much stronger communication tool than the language part, because you might be saying something like, are you ready to take your shower now? You ready? Is this, you're gonna take your medicine? And then you're nodding along and they're nodding back at you. And then when you go to do it, get out of my, no, wait, you said you were ready to take a shower. Well, you thought I understood what you said, but all I was doing was nodding along because you were nodding along. So that's a common thing that happens. We kind of miss the boat with each other. So now, in the time of COVID-19, we're all wearing these lovely masks all the time. I'm wearing a cloth mask right now. Are you noticing any difference in how much you're able to understand me? Would you like to take a bath now? How are you doing? You look really nice today. I'm speaking in the same voice I was speaking before. I'm speaking in the same voice I was speaking before. But did you notice a difference? And what else is missing there when I was doing this? And I'm wearing glasses too, so that makes it even harder. Most of my face is covered by something. And we're missing, I have robbed you of this whole side of my face, my smile, but ability to read my lips, to help if I speak slowly, maybe if I look at your lips. Have you had the experience with, not even with people living with dementia, with your coworkers, when you're standing around talking like, wait, what did you say? I know I have for sure. I've had to have people repeat themselves. Sometimes I do something which makes no sense, but if I can't understand someone, I'll like take down my mask as if that's going to help me hear them better. But somehow my brain knows that this mask is getting in the way of my comprehension. So I want us to take a little time out when we're about ready to try and communicate with someone who's living with dementia, to think, well, how can I get connected? Because as Tonya mentioned, there might be you might have experienced some people becoming fearful by being approached by someone with a mask like this. What's going on? I can't read your intentions there. So how can we help them get that connection and not feel threatened by this mask? So one thing I want to share from Halikuike is and I know things are changing day by day, week by week, and we're all doing the best we can on this new journey. But in the very beginning, everybody at work was wearing these kind of cloth masks. And then we recently switched, and we noticed immediately the residents were having a much harder time understanding us, right? And reading us. Some residents who had, let's say one of our RNs shared with me, had a very good relationship with this resident. This resident has become distrustful of her when she wears the mask, very suspicious. So things like paranoia might come up, and anxiety more, because why is everybody wearing this mask? And so recently, when we were able to have enough of the paper surgical style masks, and following CDC guidelines for direct care staff, we switched to paper masks. Immediately, we noticed a difference just in the clarity with each other. We could hear each other better. These cloth masks are so muffling. They're great. We need them. But there was a big difference in terms of our ability to communicate with using those masks. But there was still the challenge of not being able to see the face. And for example, I was upstairs with a resident this morning, and I was at a very safe distance, I don't know, 12, 15 feet away. And I looked at her and smiled and waved. And I'm probably small on your screen, but can you really tell that I'm smiling? Maybe not really. So she saw me and kind of waved and made a little puzzled face like, and it wasn't until I pulled one side down from my safe distance and smiled and gave her a wave, then she kind of took a breath and could relax. And I put it back on, and then I'm able to come up to her. So I gave her that message that it's me, even though she might not remember me, that's okay, but it's me, a person who is not threatening. And my face signaled my intention. And then I could come in. So I could put my mask on at a safe distance and still kind of overcome that hurdle. And so when we're able to get in and have them accept us being closer, where we have our safety precautions on, we still get muffled, whether we're wearing the cloth mask or the paper mask. So this is where, and then the cue card that's up on the screen, these are tips that apply anytime for people working with people living with dementia, helping to communicate, but even more so with this mask time. Like Tonya said, low and slow, low and slow. Keep it short, keep it simple. Keep the choice simple. So the more words, we love to talk. We are really, really good at it. In fact, you're all signed up and I'm just, blah, blah, blah. I can go on for a long time like this, but you are able to take in all that data. And, but again, with the timeout, my brain, I'm living with dementia, my brain's processing speed has slowed down considerably. My language center can't take in all those words. Maybe I'm getting 3, if I'm lucky, 4 out of 5 words that you're saying. So help me out. Speak slower, speak lower, more simply, and back to the visual cues. Everything you say, if possible, use a visual cue. Would you like this, if you can see me, or that? This or that? So you're holding it up. This dressing or that dressing? This shirt, that shirt. But the visual cue. Stand up, use your hands. Up, stand up. Come, use the hand and over exaggerate, right? Slow. I can make these symbols without using any words and you would know what I'm saying. Come. So for those of you on the phone, I'm making a come with me symbol. I don't have to use any words. Double thumbs up. Double thumbs up. Everybody knows what that means. Great job. So use these visual cues along with the simpler words that you're using. Demonstrate on your own body what you want. So you want to help someone with the glasses? I happen to wear glasses. I can show it on myself. We're going to fix your hair. Show it on yourself. So I'm showing you. So don't just say it. Show it. Okay, one more time. Don't just say it. Show it. Use objects, right? Break it down one step at a time. And using one step at a time, we can get from here, the chair, to the bathroom. And once we get to the bathroom, we can get through that process, but one step at a time. Break it down, keep it slow. The other thing I wanted to mention is no matter, and this is true even without COVID-19, but all of us, at Holly Kuike, I have to say, one of the, I would say, silver linings or things that have been a positive thing about our residents living with dementia is they have no awareness of this trying time and honestly sometimes terrifying time that we're in. Their day-to-day is the same, but that's not true for us. Our stress levels are quite high. We have things going on personally, we're having to go out into the world, and at work it's just very stressful. And so when things get stressful, we might get stressed a little more easily. If you start to feel yourself getting frustrated, here's my big timeout symbol again. Take a timeout. And who needs a timeout? We do. And take a breath. And if you're not shy, you can do this in your office with you. It's very useful. Take a deep breath in. Take a deep breath out. And one more time. And out. And no matter whether the communication or what you're doing with the person living with dementia ends positively, like, oof, they let me give them a shower, or negatively, like, that did not work out, I'm soaking wet, I'm the only one who got a shower out of this. No matter what, say thank you. Like, just, thank you for helping me. Thank you for doing this with me. I know it was hard. I'm sorry. I wish it could have been otherwise. But always end everything with a thank you, no matter how it went. Even if they say no way, like, I'm not going, okay, thank you anyway. Thank you for listening to me. And because it's all about the relationship. It's because this relationship is going to go on for a while. It's not just about the one shower. We're caring and loving these people every day. So even when things go well, and this is good advice for not just people living with dementia, try to end on a positive note. So because you'll get an opportunity to come back and try and do better, do something different next time. And I kind of withdrew myself from saying do better at that moment because we're all doing the best we can every day as professional healthcare workers, long-term care workers, family members, parents, and our residents who are living with dementia are doing the best they can every minute of the day. With the brains, with the changes that are going on in their brains. And so between the two of us, I would say for sure for me, my brain is not working the best it can every day during this COVID-19. There are some days I cannot think straight. And so I say we're all kind of impaired right now, not just our residents. So cut yourself a break, take a deep breath, and just take it one step at a time. I see in one of the text questions about seeing people with large photos on the name tags, like a big picture of like my face here, or another thing I've heard about clear masks. I've seen those too. I haven't heard the one thing about the picture on the name tags, that would be nice too, but you're still robbed of that information that you're trying to give at that moment, that your smile. And I haven't seen or tried clear masks myself. I imagine that they would still muffle the sound somewhat. So what I wanted to have you have as a takeaway, this Dementia Assist card, there's actually two sides to it. We're just showing this one, and you see on the side on the right, it says what to say. Those are all the tips that I gave, because I really wanted to focus on the mask thing, because that's something we're all living with every minute of every day while we're at work. But the other side of this cue card has some information on dementia. It's the PDF that Ida will be sending you has different sizes, full page, half page, quarter page, so you can use it with your staff, cut it up. This is a free a handout from Positive Approach to Care, so feel free to copy it and use it as much as you want. I'll pause here. Ida, you're muted.
Sorry about that. Yes. So I'm going to invite Dr. Liu, just because, sometimes it doesn't go well, and folks are very, very stressed and sometimes aggressive. And I just wanted people to be aware of other psychiatry resources as well. And then after that, we'll open up to questions. Go ahead, Dr. Liu.
Okay, hi. Well, yeah, do I look dark? Yeah, I cannot see my face. Am I pretty dark?
Yeah.
Okay, yeah, this is exactly what not to do if you're ever doing an online visit with people with dementia, because they're going to get confused regarding who this, dark, shadowy figure is. And I have no idea how to correct it, but I'll figure out one of these days. And I guess with the COVID,
You're
when it started,
backlit. That's why your face is dark. You need more light on your face.
yeah, or okay. Anyway, so when the COVID started, Psychiatric Association, we're all predicting that, well, there's going to be a lot more people acting out, not adjusting well in nursing home setting. But from my experience of maybe 10 to 15 nursing homes, so far so good. We haven't had this huge increase.
I'm sorry, I think you're breaking up. I don't know. Can you get closer to the mic and see if that helps?
Okay. So we haven't had any huge increase of behavioral escalation or physical aggression. So far so good. Can you hear me okay? And I think the reason for that is instead of facilities doing a lot of what I call group activities, everybody is focused on doing a lot more individualized care because now, which is what we always wanted to do, to lessen medications and to provide person-centered care that is appropriate. So in the past, what I've noticed is, maybe 60 or 70% of residents will be doing bingo or doing music therapy as a group. Maybe 20 or 30% of the residents are able to participate, so looking at art or making sensory stimulation. That's not the routine anymore. Now I'm seeing therapists, staff, nurses trying to engage the patient regarding exactly what they want to do on an individual basis in the room. And I think that has led to a lot of de-escalation of what could have been triggered due to sensory deprivation. So I'm pretty impressed, by all the effort by the staff to offer person-centered care. So let's see what else. And also going into video visits, I want to make a couple points so far for now. I don't know how many facilities are doing online care visits with physicians. And I just have a couple of recommendations. So Dorothy was saying that we really have to make sure that the patient can see us, not just by sound, but allowing us enough visual field to do hand gestures. So this would help to add a new dimension for us to talk to the patients. And also frequently, I see a lot of staff placing the video way too close to the patient like this. So this makes it hard for the physicians to infer any visual cues or how they respond to the environment around them, so we can make the appropriate recommendations. And a couple things is, and also I want to make sure that because of the COVID risk, I have seen enough staff being very close, holding the video this close to the patient face to face, so exposing the staff to unnecessary risk. So you just want to be sure of that. And also going back to individualized care, there's now, because we do a lot of online business now, greater awareness of making sure that the residents are able to see appropriately whatever is on the video screen, making sure that the residents are able to hear whatever is spoken via the speaker. So I'm seeing a lot more residents finally getting that, eye checks or glasses, hearing aids waiting for the longest time. And now we're all looking at that because we have to resort to online care. So that's, so there's a lot of silver lining of this crisis. Let's see what else. And also, I had a few patients that, a lot of people grew up using telephones. They may be aware of what a speakerphone is. I had at least 2 or 3 cases where they just simply could not recognize or able to speak to a person face to face. They actually got agitated, like, who is this person? I don't recognize this person. Why am I talking to a picture? So what we had done was we actually shut the video off. like this and tell the patient that, oh, Dr. So-and-so is talking to you through a loudspeaker or through a speakerphone. Then they're not as confused or feeling overwhelmed, not knowing exactly who you are. But they're so accustomed to talking to the phone, so you can do that with families, visitors, or friends, in addition to just having a doctor visit. Let's see. I mean, I think that's pretty much it. I'm just really glad how everybody has been pitching in to do whatever it takes for again, individualized care. So so I'm pretty impressed so far. There are studies now among the Geriatric Psychiatry Association look at different outcomes. If there's any more falls, more episodes of agitation, or people getting discharged, weight changes. So, but the COVID is so new, so it may be another few more months before we start seeing any kind of evidence-based outcomes. So that's pretty much it.
Thank you so much. I know your voice was cutting in and out a little bit. It was a little tough, but I think the main takeaway is, just be mindful of that, the video distance when you're doing the video chat, maybe using telephone, which is more familiar. And that person-centered care is that was important before, but it's now actually saving everybody because that is what actually decreases agitation. So there are a lot of chat questions here. So let me get to the chat question. Where did they go? Hold on. Okay, so let's just go to some of these chat questions. Okay, oh, actually, just wanted to mention, so Guam said that they don't have access to Alzheimer's Association out there. And I'm wondering, Tanya, is it possible for them to call you also still and hook up their resources?
Yes, please. Please call us. Call me at 808-518-6651.
Okay, great, thanks. And of course, and also people were wondering about the handouts and stuff. On our website, there is a section where you can download resources. And so you can get a copy of these slides with the number and the contact information, as well as the cue cards that Dorothy Colby is sharing with us. So those are where you can get it. Okay, let me just see here as well. Oh, hand holding and hugging. What do we say about that? I mean, these folks really need it sometimes. What do we do? Dorothy or Tanya, can you share?
Yeah, no, 100%. We all human beings, we need touch. And I think we all are feeling the distance between us and others, very acutely. So I know for us at Halikuike, many of our residents need not just hand-holding and hugs, but real hands-on assistance. And no one would suggest that we don't touch our residents anymore, So my holding you to help you go to the bathroom is just as important as my holding your hand once in a while, and I can take the same kinds of precautions and have the same protective equipment and wash my hands like I'm supposed to and still be able to give that kind of connection. And in terms of hug is like super intimate, I know, but there are other touches that can, a rub on the back, slow, palm pressure, that can be, give that fill that need for human touch and warmth and connection that might not be putting your face right up against the other person's face.
Great ideas. Absolutely. And actually, I was just thinking that really, because persons with dementia cannot really do any of these social distancing things, and they really need to, and they touch everything anyway. So I think, I think there's really no way around even the hand holding and the personalized care. And it's just the solution is really just more washing, environmental changes.
Yeah.
Okay, let's see. We have, the questions with the assist card. Okay. Yeah, a lot of trouble hearing Dr. Liu, unfortunately, but I hope you got most of that. Okay, great. And we support Guam, CNMI Samoa as well. So Alzheimer's Association here does reach out. That's great. Okay, I know communication is a challenge in this time. How about the activities to keep them busy or avoid boredom? And actually what I would like to do is kind of open it up to a couple folks out there who are, if you have really creative social distancing activities, I want you to just speak out and say what a couple of them are. That would really be great. Okay, people are shy.
That's,
Somebody was,
I'll say something. I was researching just different things, and I actually found something that my old facility where I used to work at on the mainland, they were doing, hockey's really big in Missouri, where I was working, and so they had a trash can, and it was a flat trash can, and then they had a ball and a broom, and so they would go to each resident's room, and then they would try to play hockey that way. So it was more of a, one-on-one thing, but it was still something different, and more active. So that was something that I thought was different and fun. And they've also done a lot of taking pictures with just signs and things like that to send to their family, and they put it on Facebook. So.
Great. Here, Diane Paloma is sharing that some of our volunteers will sing and play music and live broadcast it for us. We turn up our sound bar and have a private concert. We record it and then we can replay it regularly for them in different rooms.
yeah, music is so powerful. Music crosses all levels of dementia. It's a different part of the brain than language. It really is, and it's something you can do at a distance as well as close up. You can do it with the headphones, or you can do it in a group that's spaced out appropriately. Yeah, music is well, it's, again, I keep saying all human beings, it's true, right? But people who are living with dementia, it's such a powerful engagement tool, and it brings you back, as we all know. If you hear a song from when you were 16, you're 16 again.
Great. Okay, here. How difficult is it for residents when staff that they're used to working with aren't able to work with them due to quarantine orders? Folks with dementia are used to a familiar face and a comfortable routine. I'm just going to chime in here a little bit and just say, I think that, yes, you can't really replace a familiar person. However, I think really trying to connect with that sort of very person-centered approach is an important strategy to employ during that time. I think that's when you can make new friends.
So I was thinking too, maybe at the end of every shift, going to the next shift, maybe just have kind of a person-centered, different kind of approach on giving the update for the next shift. Where you give the update, all the physical things, maybe just kind of go over the person-centered things if someone's not familiar.
Mm-hmm. Yeah. How about our facilities beefing up the use of tablets to FaceTime friends and families? Is this, because they need a lot more one-on-one, and so, maybe buying more than one iPad for the facility, right?
Yeah. I'd like to share something about the Halikuike. The answer is yes. We're using it a lot more for FaceTiming and things. But one of and not just having enough of them, but the other challenge is the time. So let's say a 15-minute FaceTime call with a resident actually really takes a half an hour, because you need time to transition into getting them ready and then transition out. So one of the things that we found very helpful for us is we use an online, I guess it's an app or a website, to do online scheduling. So we set the times that we're doing it, and families can sign up. So it's not kind of in the beginning, it was like a hodgepodge. Oh, someone wants it now. So we were able to include it into our schedule so that we can give our larger community of residents the attention that they need, and yet pull aside the activities leader to do these one-on-ones too. And that's helped us a lot. So being able to schedule it, limiting the length of it, and asking families to just do it. Maybe we started out as once a week because we want to have all families be able to be included.
Great. Yeah. Okay. So we have here Samantha. Hi, Samantha. Working with the VA in the CLC community nursing home programs, and many of them are using tablets with FaceTime for friends and family. And one of the nursing homes just did a drive-through similar to graduation. Samantha, you want to share? Want to describe this drive-through?
I'm wondering if their mics are muted. I'm wondering if that's what's going on, maybe.
Saw some pictures online of Pololo Chinese Home doing that drive-through thing too. I think I'll just say, I don't want to just fill the empty air, but I picture it for our residents, their like field of focus in terms of is pretty short. Like we really need to be kind of close in for them to be able to connect and see what's going on, and that kind of long distance, like who's in the car. We've chosen not to do that for now. We may in the future because the FaceTime, even though it doesn't, in some ways it feels like you might say, oh, it's not the same as having someone there. I've had a resident who at the end of the call with her son and daughter, and they said, okay, Mom, we'll see you later. We got to go. She's like, hold on, let me get you something to take with you before you go. It's real. I mean, that was a real visit. Nothing second rate about it.
Yes, and yeah, it looks like families drove through and had signs and waved, and the residents were wheeled outside. Lots of happy cheers from everyone. And actually, I would encourage you. Father's Day is coming. We just had Mother's Day, right? Father's Day is coming up, and maybe you can start scheduling and making plans and doing something extra special.
Mm.
Very person-centered. I'm just scrolling here. Anybody else have some really great ideas?
I have one more thing I wanted to share that we did that helped us, kind of like the scheduling. We have a lot of families who wanted to email pictures for us to print out and show residents, or the video or something. And we all know how our email inbox just gets like, it's just like, whoa, where did that email from that family go? We set up 3 different drop boxes for our 3 different locations for families to upload to. So it's one place, they're all there. The activities directors can check every day their individual locations, drop boxes, and see what's come in. So it's like a virtual, we're calling it our virtual mailbox, but it's really helped us not get overwhelmed by and keep track of all those kinds of things.
Great. I see here Warren Wong actually wants to talk a little bit about his tablet-based product. Warren, I want to open up the forum to you.
Yeah, I actually don't really want to talk about it right now.
Okay.
But it's a relatively early stage product, and the concept is that people upload their own photos and they're given cognitive hints to kind of remember names and relationships. It's meant for people with mild to moderate dementia. It's still a product that is in development. It's in the Apple Store only for Apple products.
Yeah, thank you. Yeah, so maybe try to use, how our kids, they're all into apps and it keeps them busy hours and hours on, who knows, right? That could be fun as well. But of course, it'll tie up your iPad for use for others. And so you really might need to get a few more, unless families supplied, I suppose. And of course, there's the cleaning aspect of it. So yeah, so look at this, an idea about visitor walkthrough viewing with window visits with a cell phone to talk at the same time. That's a great idea. And pocket handheld Vegas games. Catherine, do you want to share something about it? What's your experience? You have to unmute yourself. Maybe they can't.
I don't think they can do it. I don't think they can.
Oh, John, are they able to unmute themselves? They can. Catherine Shawhan, can you unmute? Okay. Oh, I don't know. Okay, well, anyway, yes, please keep typing in the chat box as well. Any other great ideas?
Yeah, can you hear me okay? I
Yes.
think my connection is much, much better now.
Okay.
So I just want to re-emphasize how important music therapy is. So
Yes.
of all the different types of non-medication interventions like smell aromatherapy, massage, environments, or different like snots in a room, the only one that's been really tried and true to show consistent effect is music therapy. And what's nice about that is most older folks, they may not recognize like a smartphone versus a dumb phone. They may not, know what a Bluetooth device is, but all of them will recognize what a very traditional headset would be. And if you get the headset with the big muffs, with the big pillows, it's actually very comforting in a way. So I've seen more and more patients benefiting, just by sitting in their room, lying down and listening to music that is familiar to them as they're growing up. And that's one of the best ways to provide sufficient stimulation and decrease that level of agitation.
Yeah, that's true. Yeah, we do a lot of music at our facility.
And they're all used to doing this, as they're growing up. So we just, we're not doing anything new.
Yeah. And everybody can certainly still do exercise, with the music and stay fit, right? Exercise with the music and dance with the music. You can still do it at a distance and you can still enjoy each other. I was actually thinking other social distancing kind of activities would include gardening. It's outdoors as well, and you get a little bit of sun if you can. Anything else? Music and memory has worked very well in our facility, yes. Okay. How about families who are anxious? What have you guys done with folks like that? Dorothy?
Keeping in touch and communication and keeping that relationship open is key. We have done both an online family support group and also an online family, we called it guided meditation and prayer, non-denominational. We had a reverend who was also a dementia care specialist lead that for us, and that has been really helpful. All throughout this, just sharing information clearly and often. It takes more work, more. Not I don't say work. I think it's more time, but it really helps because they're stressed. It's so hard. It's so hard to have separation, that physical separation. I mean, the FaceTimes might seem really real to our residents, like I described, but it doesn't. It is not the same for the families. It's not as good. Yeah.
We have support groups and we have care consults too. So it always, and our education programs too, but mainly our support groups.
Okay, Veronica shares, we do communicate with the families by email weekly, or they can call by phone, and we can also partner with the school psychology department to provide professional consultation. Wow.
Wow, that's great.
Wow. Yeah. Oh, and I was just thinking also, I know the medical school was having students and maybe there's partnerships with the local elementary schools as well to draw cards for the kapuna and draw pictures and have them, share those and open those. Children's drawings are precious. They always bring a lot of joy. And I actually encourage, when I speak to the families I take care of, I encourage them to have their grandchildren draw pictures and send letters so that they can open them and look at them again and again and again. Okay, great.
Yeah, those
Oh,
we've
my
had a
goodness,
number of
3 o'clock.
organization times up. Okay.
Okay, great. Okay, so it looks like time is up. My time, guys, flies by so fast when we're having fun. Okay, so just in closing, you need to go to our web link in our group chat that Michaela posted. We really want your comments and to help us plan for future programs. And of course, you can also put in the chat box any other topics that you would like us to cover in the future. And on Monday, it's a holiday, so make sure you take care of yourselves and enjoy it and relax as much as possible. Don't think about COVID too much. And on Wednesday, join us back again, and we're going to be talking about NHSN COVID reporting updates. It's required for all facilities to be reporting COVID, and so Tom Vincent, who's a data analyst from Mountain Pacific Quality Health, is going to speak to everybody about that. So we'll see you again on Wednesday. Take care. Thank you, everybody.
Thank you. Bye.